Okay, I'm talking to Dr. Richard Schaffer, radiation oncologist who treats people with Dupuytren and Ledderhose. Richard, good afternoon. Can you tell me what should people do after they've had radiotherapy? What's the aftercare? What can they do or not do?
Okay, so just to briefly recap on side effects. So during the radiotherapy, I wouldn't really expect you to have any major issues, but about 2 or 3 weeks after each week of treatment, you may well get some mild redness and soreness of the skin, a little bit like mild sunburn, perhaps some dryness. I mean, very rarely the skin might blister if you're really using your hands very hard. But for most people, those side effects are mild. And most people, all they need to do is really a simple cream, things like an E45 or aqueous cream. Sometimes people use creams which contain urea as well. The other thing, if you treat disease on the feet, you might get a flare in the pain. And in my patients, approximately 5 to 10% of people find that the nodules in the feet might get a little bit bigger or a bit more tender, but over a few weeks or perhaps up to a couple of months. And if that happens, you take some simple painkillers like paracetamol, that sort of thing. For most people, that would be enough. But there are some things you should avoid. So most things that you can do. So you can drive during the treatment and after the treatment. You can do normal work, so use a computer, that sort of thing. Play golf, do the washing up, that sort of thing. If you're having your feet treated, you can walk normally, jog or run if it's not painful. But there are some things that you should avoid. So extreme stresses to your hands or feet. So that might include lifting very heavy weights in the gym, or if you do manual work, lifting very heavy building materials. Friction to your hands. So for instance, if you go sailing, you shouldn't have ropes sliding through your hands, or rock climbing, that's a lot of blunt trauma on your hands. Extreme heat and cold. So taking things out of the freezer, you might just want to wear a glove or get someone else to do it. This is for basically about 3 weeks after each week of treatment. And obviously we're living in a pandemic time at the moment, but if you can avoid alcohol rubs, maybe you want to use soap rather than alcohol rubs at the moment. But a lot of these things really you're not going to be able to avoid. So if there are things you have to do, then just try and protect your hands as much as you can. So wear gloves or some sort of protection. So those are things to avoid doing. And then follow-up, of course, will vary between different practices. Personally, what I do, because my patients come from all over the UK, is I send a questionnaire at 3 months, or sometimes I see patients either on Zoom or face-to-face. And for most people, by 3 months, they will have hopefully noticed some sort of response or some sort of stabilization of the disease. And the immediate side effects, such as the redness and soreness, should really at that point be better. But of course, if there's anything ongoing, then I'd like to know about it. So that's why I send a questionnaire. And of course, if I need to, I would see people in clinic or by phone. If over time the disease gets worse, then it really depends on the pattern of worsening. So if it's on a hand or foot that hasn't had treatment, then that's a separate issue. We can certainly talk about treatment, which would be separate to the initial treatment. There's no reason if you've had your left hand done why you shouldn't then get your right hand done fully. If, however, let's say you've had your left hand done and then there's new disease that comes within the radiotherapy field, then that is a separate question. I think I've covered that in another video, but as a very short summary, if it's more than a year, you've tolerated the treatment initially, and you've got a new nodule within the field, then we could consider giving further treatment, which would tend to be just a single week of 5 treatments rather than the 2 weeks. So that's something that we would discuss. If, however, it's worsened so much that your finger is contracted, particularly if it's more than 20 or 30 degrees, then at that point, really, it's a matter of going to see a hand surgeon to consider how they would release that contracture. And of course, there are various ways they would do that, including fasciectomy, so proper surgery, a needle eponiotomy, and perhaps zyapexis if it's available.
Thank you, Richard.